Right now we're up against a full hospital. We're up against a situation where we don't have additional capacity at our hospital, additional staffing to deal with it. So we're trying to make contingency plans in case we need more medical assistance.
For about the past 3 weeks, we've seen day-over-day increases in the number of patients that are presenting, and over that time, some of those patients have been diagnosed with COVID, and they've needed hospital beds. And the disease process of COVID requires about a 20 to 30 day stay. In fact, what we're seeing is 20 is kind of even a low number. And so those patients are needing to occupy our beds for much longer, so we're not turning those beds over. And so that's just created basically not enough hospital beds. That's happening not just at Stillwater Medical, it's happening throughout the state and really throughout the nation. And so when we run out of hospital beds, our normal process is to transfer out, and we're struggling to be able to do that. And so we've had to expand our emergency room already. And so with the holiday weekend coming up, a lot of events going on, people getting together, that'll be an increase of folks coming to our town. And so we want to be as prepared as we can to help provide the potential medical care that people are going to need throughout the weekend.
We need a little early bird.
This Delta variant, we've just seen it's such a steeper variant than the one before, and there's just a lot more spread. It happens a lot faster. I would trade in a heartbeat for the last variant over this one. In the state of Oklahoma, there's no capacity in the healthcare system to a large degree, especially when someone needs a bed, a hospital bed, a staffed hospital bed, especially ICU. Those are really hard to find right now. Yeah, this is not what we want to be doing, I can tell you that. You know, this is what, unfortunately, the reality of the situation is this is what the warnings have been about from our public health departments across the state and across the nation, that if we don't take those precautions, and that's what you see, is we're being stretched to a limit that we're going to have to take some measures that we don't typically have to take.